Well, welcome to the NHPPA Talk Forum. My name is Sean Buckley with the Natural Health Product Protection Association, and I'm very pleased to have with me today Dr. Stephen Malthouse. Stephen, welcome to NHPPA Talk Forum.
Yeah, thank you, Sean. It's nice to be here.
Yeah, no, you're one of my favorite guests, and just so people are aware, Dr. Malthouse also was a speaker at the health show, and you can find his I guess, presentation at the NHPPA.org. I'd like to introduce you for those who don't know you, although you're pretty well known. You were a medical doctor. You practiced medicine in the province of British Columbia for 45 years, which, my gosh, I think the governor in general should give you an award. That's a long time of practicing medicine. You practice family medicine, palliative care, emergency medicine, and integrative medicine in both rural and urban settings, and you've been involved in overseas research into childhood diseases. You are also the founding president of the Canadian Integrative Medical Association, and you're currently a director of the Canadian Health Alliance, which is a 5,000 plus member association of practitioners and members of the public. And you've been integrating homeopathy into the medical practice for roughly 25 years of your practice. So you've got quite a history. I do want to talk about homeopathy a little later. I kind of want to talk about nutrition and some other things first. But so just a teaser for everyone, we're going to get into how is it that this medical doctor ended up practicing homeopathic medicine also. Now, Stephen, let's talk about nutrition, because one thing that I kind of learned when we were doing this health show was just that our food supply has become, and I knew this before, when you're interviewing people that had real health problems that were then solved with, largely nutrition, it's kind of like, okay, this is more serious than I thought it was. And so I wanted to ask, in your practice, can you share kind of some conditions that you came across that basically were a result of, not getting enough of things? I know that we were speaking earlier perhaps about osteoporosis and vitamin D and the like. Can we start there and then just cover some other topics?
Sure. Well, people have probably met doctors in the past who say that vitamins are just expensive urine. And because the thought is that you don't need them and you just pee them out and it's a waste of your money. But we see a lot of conditions in family practice where people seem to have deficiencies. I think vitamin D is one of the biggest ones, particularly in places like Canada or anywhere north of the 39th parallel. Or if you're older and maybe you don't absorb vitamin D or very well, if you haven't got much if you haven't got much subcutaneous fat, if you're behind glass, for example, you work in an office all day long, then you're not exposed to, and in many cases, you're not exposed to sunlight, which is needed for converting the vitamin D in your diet into the sort of part of the pathway to the more active form. So a lot of people are vitamin D deficient in Canada. I think in the wintertime, pretty much everybody is, unless they take a supplement, because there's just not enough sunshine. And we do need the sun's rays to do that conversion. So there's a very good example, which is almost ubiquitous in Canada. And for a lot of time in the summer, people are vitamin D deficient. So in my opinion, everyone should be either taking a nice holiday a couple of times in the winter and going to a sunny spot, or they should be taking vitamin D supplements. And that's the current thinking, I think, for many physicians who are looking at nutrition. And so,
right. And let's just slow this down a little bit, because vitamin D it's an essential nutrient. Like, so not just for bone health, which I know you're going to talk about, but also for immune system and other things. And
absolutely.
just so that people understand what you're saying is, I just want to it crystal clear for Canadians. You actually need sunlight touching your body, not through glass. You need to be outside getting sunlight, because your body converts the vitamin D you get from your foods into a type that your body absolutely needs. So you're designed for sunlight. And if you cover yourself with sunscreen, that also prevents you from making the proper vitamin D. So it's almost like our public health wisdom. Well, I just now ignore it. Sorry. If
Well,
Public
well,
Health or Health Canada
oh,
says black, I know it's white.
on that topic, we're told to stay out of the sun from around noon, or from but in fact, the time where you actually get your best conversion of vitamin D is between 10 a.m. and 2 a.m. So just don't burn, and be cautious. Take as much as you can, but as people become more exposed to sun and tan, they actually will be able to stay out in the sun longer. That's obvious for people. But we did find that vitamin D, particularly for people who are dark skinned, that's another issue too. They also need more vitamin D, particularly if they've moved from a tropical country. Let's say they're African in birth, and let's say they have dark skin. I mean, there you're getting lots of vitamin D, but not when you move to Canada. So that's really important for people who have lots
It
of
is.
pigment in their skin.
And I just want to unpack that again. So what you're pointing out is, because I wasn't joking. I mean, if Health Canada or Public Health tells me something, I just believe that the opposite is. So we're actually told not to go out in the sun between 12 and 2. This is what we're told publicly. But there's a basic rule: if your shadow is longer than you are, you're not making vitamin D. The sun's too low
That's
on the
good.
horizon.
That's a good one.
Yeah. So, well, I mean, I heard that from an expert in vitamin D. If your shadow's longer than you are, you're out at, I mean, don't leave. It's still, but you really need to be when the sun is highest.
Yep.
So
And you need ultraviolet B. You need type B ultraviolet, and that's when the sun is kind of high up in the sky. And so the best time is between 10 and 2. But that doesn't mean you should go out and burn. But you don't want to be wearing sunscreen if you want to convert, because it blocks conversion.
Yeah, I mean, it's funny when I go, south on vacation. Well, first I try and just pre-tan beforehand, but I just gauge myself. So I'm just in the sun a little bit at first, and then the next day, and you just maybe be smart about it, people.
Absolutely.
But you made a point. Like here, the Northern Hemisphere, we were Caucasian, and now we've got a whole bunch of immigration. We have people from the Southern Hemisphere, many who just have a lot of skin pigment, like people from Africa that are black. That actually blocks the sunlight because they're from zones where they're getting tons of sun. So they're making enough vitamin D, but they need protection because they have what would be too much sun for us. So they need to supplement. Like they're in real bad strait in Canada.
That seems to be the way. And osteoporosis is a very common disease in the elderly. Not surprising, of which vitamin D may play a role. It takes time for things like osteoporosis to occur, and so what you want to do is you want to kind of be preemptive. You want to prevent getting the disease, and that is good advice for any type of nutritional disease. I mean, you don't want to wait till your teeth are falling out with scurvy, before you start taking some vitamin C supplements, right? And of course, we see people going for surgery, and in studies they've done where they will test their vitamin C levels, they find that people are actually borderline scurvy when they go into the hospital. And then they're having surgery. And people may know that vitamin C, not only is it good for like protecting against infection, so postoperative wounds and so on, but it also is important for connective tissue, and that would and the formation of connective tissue, and therefore healing ability for wounds and for any surgery, whether it's the internal or external, superficial or deep. And so taking vitamin C supplements would just make sense, particularly since it's one of those vitamins which we cannot produce ourselves in our body. Unlike other vitamins, hormones, we can't produce that. So we have to take a external supplement of vitamin C to maintain our levels.
I just have to slow this down because, Stephen, you're basically communicating with us. So people are going to the hospital for surgery, and basically they're getting blood work done. They're getting stuff tested, and many people are testing so low in vitamin C that they're borderline scurvy. This is what you're telling us,
right?
And just so people understand, so scurvy is a condition caused by not enough vitamin C, which you literally can die from, but you can lose your teeth and have a whole bunch of other problems. And we know about scurvy because Britain or the United Kingdom, when they were sailing all their sailing ships around at first, they would have huge health problems with these long ocean voyages because the sailors weren't getting enough vitamin C and they were getting scurvy. And so they were trying to figure out what it was. And then they learned that if they ate limes, they might not have known at first it was vitamin C, but if they ate limes, then that solved it. They didn't get sick, which is why British sailors are called limeys.
That's right. And they used to get their lime in their grog. So they had to give it to them. And and if they ran out of grog or lime, but they ran out of sort of lime juice, then they'd have to find another source, such as cabbages or other type of citrus fruit. They actually use limes in the British Navy because they were at war with Spain, and lemons have more vitamin C in them than limes do. But they were boycotting lemons because they came from Spain, but they could get their hands on limes. So that's why they used limes and got were known as limeys.
So just being that we're doing, interesting kind of nutritional things caused by the British Empire back then. So gin and tonic, which I don't know what vitamins and minerals we get from gin and tonic, but so that, Britain had basically, I don't know if it was Mumbai or what, but it was, the last big kingdom in India. And it's all, it's a swampy area and their sailors are their troops are really suffering with malaria. Well, they want them to take tonic, but it just tastes like crap.
It's quinine. It's quinine.
Quinine, exactly. Mm-hmm. But if they mixed it with gin, like a Bombay Sapphire, for example, it actually, it tastes reasonable. So they found that they had way better compliance with the troops taking, quinine if they added a little bit of gin. So that's where gin and tonic comes from. Just so you know.
I don't know. That sounds a bit like an urban myth to me, but but I agree
it's
with
such a wonderful story. I want to believe
isn't it though? And then they used to put limes in it because they're British, so they put limes in it, right? They don't put lemons in your gin and tonic. But and it's very interesting that it has a quinine, which has a strong connection to homeopathy, because of the original experiment.
Share about that briefly, and then we'll go back to scurvy, because I'm horrified that Canadians are borderline scurvy, a lot of us.
Well, yes, just think about it. There are some things that we could do in medicine which could really revolutionize practice. And one would be, I think, to give everyone vitamin D supplements in the wintertime and through the summer if they have other predisposing factors, like they work in an office behind glass all the time, right? Mm-hmm. But and vitamin C would be another one to reduce infections, particularly in the wintertime. If we have, we think they're infections, but they could be other things like response to changes in atmospheric moisture, more travel on the roads, going back to their stressful job after the summer. So the whole question of, what is the real cause for flu-like illnesses and colds, that's up for debate. But certainly, vitamin C in the wintertime would be pretty smart to do. And there are other things too, like lithium, for example. We talked a little bit about that.
We're going to get to lithium in a second, because that one's important to me personally. But I just want to stick on vitamin D for a second, or C for a second, because Stephen, when the NHPPA held this health show in the fall, and so people watching don't know, basically for 3 weeks, 5 days a week, we broadcast people sharing their health journeys. So, some people were literally, on death's door and facing death, and then they find the answer, or people were just terribly disabled or suffering, and then they find the answer. And it kept coming up, with many people, that it was nutritional deficiencies. And so it kind of drove home to me, like I knew we don't get what we need in our food anymore. But I have to say, I'm a little shocked when we were talking before this interview today that people aren't getting enough vitamin C in their diet. Because I just, I'm just telling you, that's one I knew we didn't get enough D, and everyone should supplement with D and ignore the label. You need way more than we're allowed to tell you to take. But C, that shocks me. I just assumed that, people are eating oranges, they're eating grapefruits. Why do you think it is that we're low in vitamin C?
Well, because we can't make our own. Most creatures in nature, besides humans and a few others, can make their own vitamin D. They can create it in their own bodies. So
you mean vitamin C?
Vitamin C, yes. and but humans cannot. So we require a supplement, and you would have to eat a lot of lemons, limes, and oranges probably to get the amount that is optimum for your health. And everyone's going to have different requirements too, as we're individual. So you have to take a supplement of vitamin C, and yeah. So I do, and I think it's a good practice.
Yeah, no, well, it's just funny because I supplement vitamin D, and we had a speaker at the health show, Dr. James Lunny, if anyone wants to really dig deep on vitamin D. And I supplement vitamin C, like, so in addition to my multivite, like, but I think the key, and you keep saying it is, like, it depends. Do you work in an office? Like, what's your diet? So, would you agree, or what do you think? I tell people you need to go and speak with somebody who knows about nutrition, who's going to interview you about your lifestyle, about your diet, and get advice specific to you. Like, don't just wing it. What do you think about that?
I think not a bad idea. You can do a lot of the homework yourself. You can figure out a basic requirement and then try to adjust it for what you might individually require. So, for example, if you're someone who spends a lot of time in the sun in the summertime, you don't need to supplement with vitamin D. And but if you're someone, as I mentioned, who has an office job, or if you're older, if you have absorption difficulties, then you need to supplement during the summertime. So it has to be individualized. It's true. Whether you need to go to a practitioner to find that out, it might be worthwhile. I can't really say there. I mean, that's kind of up to the person themselves. I don't think that going to your doctor and making those inquiries would be that useful. Your family doctor, your GP, your medical doctor, because we receive very little nutritional instruction. You have to do extra courses, and that would require you to have an interest in that field. I know there are some that have been going on for years for doctors, and really high quality, coming from Aileen Burford Mason in Toronto, and she's still doing some excellent courses on nutrition for docs. And if someone goes to a doctor like that, you might have a little different answer than if you go to the doctor that hasn't done any of those extra curricular trainings.
Okay, so I think you made a good point, because I try and tell people, if you can, go and get advice, but you're just saying, wait a second, you may not want to go to a medical doctor because we're not trained in that. So unless that specific medical doctor has decided to train in that, it's not the place to go.
Yeah.
And in a way, you're countering what I'm saying, and which is okay, because it's going to lead to the next question. Because you're saying, you can kind of do the research yourself. And there are a lot of people that just, quite frankly, can't afford to go see a naturopath, or can't afford to go see a nutritionist. And now they may not know that if they find a local health food store, they got pretty trained people there that will guide you. But likely, most people can, if they can find a good multivite, find a D supplement if the multivite isn't good there, which it isn't going to be, and a good vitamin C, right? Is there anything else? I know you're going to say lithium in a second. Is there anything else that people, like, if they were making a list, so, good multivite, vitamin D, vitamin C, lithium, anything else you think would kind of be on a good little list for people to consider?
Yeah. Well, what I found I'm one of the worst when it comes to taking pills. So, I mean, it's you really got to make it a habit. And and you want to make it easy. So not too expensive, stuff you can get fairly, off the shelf, probably at a health food store. And also where you're not taking, fistfuls of pills 3 times a day. So my regimen, I'll say, I'm not giving medical advice to anybody, but my regimen is a good multivite. Now, often if you look in the see, has something called molybdenum in it, which is a mineral, an element. If it hasn't, usually it's a good multivite, because it means it has, they're looking at the trace minerals. They're paying attention to that. So I would suggest that. If you have some concern, or you just want to take a super duper one, I think True Hope makes a very good vitamin, easily absorbed, and has been used actually therapeutically in cases for bipolar disease. So you might want to go to that level. So that's kind of a designer high quality vitamin. But if you can't get that, then get one that has molybdenum in it, and it usually has a lot of the other things that you need. Then I would suggest adding, as you did, vitamin D for sure, vitamin C for sure. I would add omega 3 to that, which is from fish oils usually, and that would help to balance your omega-3 6 ratio, which is essential for health and has been connected to cardiovascular health and other things. That would be important. And I think magnesium too, because magnesium, we're very short on that in Canada. We have a lot of deficiency, even in young people who eat a variety of different foods, including salads. And so magnesium helps you get more bang for your buck with vitamin D. It helps vitamin D absorption, but it's also a mineral which is important in its own way. And if you're taking vitamin D, you're going to want to take vitamin K2 as well, okay? Because it helps to direct the calcium in your body into the right tissues so it doesn't get deposited in your blood vessels. That's our current thinking about vitamin K2, not K1, K2. And so I would say that if you want to take just a small segment of the vitamin supplements, you do those. So multivite, vitamin C, vitamin D, omega-3, K2, and magnesium. And then we did talk a little about lithium, which is another thing.
Yeah, let's go there, because we were talking about nutritional deficiencies, and I'll just say again, I'm shocked that Canadians are showing up at hospitals for surgeries and they're borderline scurvy, that they don't have enough vitamin C. To me, that's a red alert emergency, because it's such a vital vitamin. But lithium, so tell us about lithium, because that's a really interesting one.
Well, I've known a little bit about lithium. As a family doctor, we often were involved in prescribing lithium for bipolar disorder, which used to be called manic depressive disorder. And the doses were things like 300 milligrams, 3 or 4 times a day. So it's a pretty big dose. But and it seemed to be effective. Now there's, besides the risk of side effects, it seemed to help people with the problem. And it was a pretty common prescription for that disorder. But lately we've heard that Dr. Michael Nels, who's a German physician, has come out with several interesting books. And in that he talks about lithium, particularly the type of lithium which is connected to orotate. So lithium orotate as a protection for the brain, and that people are deficient in lithium. They're not getting it from the soil in which their vegetables are grown, and because of that, their brain is particularly the hippocampus part of the brain is susceptible to inflammation and damage. And we have seen that with some of the toxins that we've been exposed to in the last, let's say, 5 to 6 years, but even beyond that. So that's an important supplement to start thinking about, particularly if you have a family history of dementia, because dementia seems to be related to lithium deficiency and a failure of the hippocampus, which normally enlarges or grows throughout your lifetime and is important for kind of like keeps the files of memory intact. When people start, forgetting things easily, it's often or can be due to the hippocampus running out of space. So it's a bit like your file drawer is full, and you have to keep dumping out files to put new ones in. So you may be taking in your new impressions and memories, but you're dumping out the old ones all the time. Whereas in a healthy hippocampus, healthy brain in a human, the hippocampus would continually enlarge to actually provide file drawer space to put those new files in. So it's very important for people who have that family history, I think, to take lithium. And it's a very small dose. It's anywhere between 1 to 10 milligrams, I think, is the usual dose. And compared to the 303 times a day that's used with lithium carbonate for treating bipolar disorder. So that might be something to add to this. Wouldn't you suggest that?
Well, it's just interesting. I remember there was that book, Men Are From Mars, Women Are From Venus, and it was written by a medical doctor. I forget the guy's name now, but I remember I was listening to a lecture that he was giving. And he was saying the exact same thing. He was saying everyone should supplement with 5 to 10 milligrams a day of lithium orotate or lithium aspartate. Um, not, if I recall the lecture correctly, it wasn't so much memory, but he was saying just your mood, like your brain
Mhm.
needs lithium in trace amounts to be functioning well, and that it actually affects your mood. Like you're not going to be in as good of a mood because it's a trace mineral that your mind needs to be healthy. And so since then, and this is probably 15, 20 years ago, since then, that's been part of my regime. But what's so interesting, with you bringing it up, Stephen, is you're saying this is something people should be taking every day. And yet, so it's an essential mineral for our brains to be healthy, and yet it is illegal unless a doctor prescribes it for you, which isn't going to happen just for you to take 5 to 10 milligrams a day for your health. It is illegal. And why is it illegal? Because somebody applied quite reasonably to use, lithium in high amounts for the treatment of bipolar disorder. But that's by prescription, because in those high amounts, it does have to be managed by a doctor. Stephen, isn't the therapeutic dose close to a dose that can lead to health problems? So it has to be managed.
Yeah, I think that's true for most prescription drugs. They have a narrow therapeutic window, and that has to be monitored carefully, and also by someone who knows that the benefits and the risks of the drugs, the side effects and so on, and how to measure the fact that the drug is actually doing what it's expected to do. But anyway, yeah, lithium is important, particularly in areas with lots of rainfall, because it gets washed out of the soil. And they did a study in penitentiaries finding that the more violent crimes were associated with low lithium levels. So this goes back to what you were saying about how it tends to moderate mood. They felt it was due to impulsivity that was causing these more violent crimes, and then they did this correlation. Correlation doesn't mean causation, but nevertheless, there was interesting, and the fact that it's used to help to moderate depression and mania and manic depressive or bipolar illness shows that it has a connection to the emotionality of people.
Mm-hmm.
And so, yeah, you may be a cooler, calmer, more easy to get along with type of husband if you take lithium.
Yeah, well, it's just interesting, again, just so that people understand. So I think both Stephen and I, like, I'm just telling you, I'm not giving you medical advice, but I take it every day.
Yeah,
I try to do it twice a day. Lithium orotate 5 milligrams, or lithium aspartate, depending on what I can get. But what frustrates me, Stephen, is because it's illegal in Canada. So the way it works in Canada is if something's been approved prescription, like which lithium has lithium carbonate, but you're telling me, pre-interview, carbonate, orotate, it really doesn't matter. That's just, for absorption. So because lithium is considered by Health Canada to be prescription, all lithium's prescription. When, really they should just say no, at this higher dose, that's prescription. And in the United States, you can go into any health food store. It's not prescription. It's freely available. It's encouraged. And so I've always been ordering it from the United States, but it just seems that there's certain brands and types I prefer I can't get anymore. They won't ship. And I have in my secret underground bunker, Health Canada, not here, a store just in case I can't get any more, right? So, yeah, in that secret underground bunker.
Yeah, and I think people might want to read Dr. Michael Nell's, Nels, a book, The Indoctrinated Brain, because it speaks a lot about lithium, but about many other ways of keeping your brain healthy. And we're kind of under an assault in the world today, and it may have been in the past too, but it's certainly evident today with regard to our food supply and the vaccination issue, the number of vaccines our children are receiving, and also things like EMF from radio towers and cell phone towers. And so we're being bombarded. It's amazing that we're still alive in some ways, it's a testimony to the resilience of the human being. And because we're under a lot of stress.
I think they're trying, but I think you've just raised something. I wasn't thinking of going there, but it's just, it just dawned on me when we're talking about nutrition that, our brains take more of the nutrients than any other part of our body. So, many of you might be thinking, well, when they're talking about taking vitamins and supplementing to get the nutrition you need, that's so that your body is healthy. But more importantly, it's so that your mind is healthy. And if your mind isn't healthy, you're not going to feel right. You're not going to have the right mood. And so, Stephen, I'm thinking that, if some people find that they're chronically agitated, if some people just find that they're, very low mood, that they may want to consider that they're not getting, that their brain's just not healthy, like for physical reasons, and that affects mood. What do you think there's anything to that?
Well, sure. The mind-body connection it's pretty obvious to anyone who has a look. And if your body's not well, your mind is generally not well. And if your mind is not well, your body is not well. They're connected, that you can't separate them. So yeah, you've got to make sure that your any supplements you take are high quality enough to actually not just go into your body, but also go into your brain. And that's really important. So yeah, you can't really separate the two out so easily.
Okay, so now, another question on mood. So you're talking about EMF, and just so that people understand what Dr. Malthouse is talking about, he's talking about electromagnetic frequencies. So things like from our cell towers, from our Wi-Fi transmitters, from your cordless phone, from your baby monitor, like which you shouldn't have, shame on you, like literally, unless you don't like your kids.
Well,
and
you can have a plugged-in one. That might work.
Oh yeah, wired. But these wireless ones, some of them test, as bad. Like you might as well have a cell tower in your baby's room.
And AirPods from in your ears all the time. That's sending a lot of electricity across your brain. Not good.
Yeah, no. So that's what he's talking about when he's talking about EMF. We're talking electromagnetic frequency. So we're talking about our wireless, our cell towers, our Wi-Fi, and the like. Is that affects like not just our physical health, but it also affects our mood, doesn't it?
Oh yeah, for sure. And some people are very sensitive to it. They have to find a living situation where they don't have a cell tower on their roof, or a smart meter stuck at the back on the other side of the wall from their bedroom, and things like that. It's everywhere. But there is good news. There is good news, and that is to do with human adaptability. There was a study done by her name will come to me in New Zealand. Austin is her last name, and she did some study on taking water to cell towers and exposing it, and doing freezing it and seeing if the pattern would come up. That was the typical sort of I would say leaf-like pattern that we see with healthy water, like spring water.
Mm-hmm.
And initially, the cell towers really disrupted the pattern, but with repeated freezing and melting, and they don't really freeze it. You freeze it into kind of this middle state, fourth state of water, I think it is. And repeated exposure, the water then started to regain its ability to present the healthy pattern, fern-like pattern that you would normally see. And so what it suggests is that since humans are, depending how you look at it atomically or weight-wise, it's it's between 70 and 90% water, that we have that same adaptability. So it may be that has allowed us, the human beings as a species, to remain on the earth despite the bombardment of radio waves and cell tower, that type of higher frequency waves, and everything that we're being bombarded with, that we can adjust. But for those people that are very sensitive, it's a tough world to be in.
It's interesting, Stephen. One of the speakers we had at the health show was Dr. Meg Havis, from, I think, it's Cornell University, and she's an expert in this, and she was showing us a study where they would basically hook people up to a cardiogram or whatever, an ECG, so they measured, not cardiogram, ECG, and then they turn Wi-Fi on, just I think 2.4 megahertz a band, and people that were EMF sensitive, their hearts would just become irregular and speed up, and other people it would no effect at all. But and then they turn it off and the heart goes normal. But I think and that my understanding is that that is a phenomenon that can be reproduced quite easily. So there are people out there, literally, their heart rates change when they're in the wrong place, and the
Mhm.
EMF is there. So they would feel it right off the bat.
Yeah, more sensitive. Think about electric cars and sitting over a big battery. You know, what's the field around that battery in terms of electromagnetic forces? And actually, cars. You know, people have their Bluetooth on and things like that. Stuff. They have their cell phone, you know, on. They have their Bluetooth on. You know, they've got the radio on. You know, they're just kind of sitting inside a closed chamber with everything bouncing around like crazy. By the way, I should say that woman's name is Veda Austin, who's been doing the work with water, and it's really worth looking up the type of studies she's done. Very eye-opening.
And I'm going to give people some vehicle advice. So what Dr. Malthouse is talking about is, you know, if you buy a new vehicle today, you've got Bluetooth in that vehicle, and you actually can't shut it off. It used to be every vehicle had a setting, and because I used to rent vehicles all the time, and I'm actually sensitive, and I'd rent the vehicle, and the first thing I would do is go into the settings and turn the Bluetooth off. And then all at the same time, like, so it was the same year, it didn't matter what brand of vehicle, you could no longer turn the Bluetooth off. Well, I do know it's 2013. So as of 2013, you can no longer turn the Bluetooth off, which is interesting because it's just their program. There's no reason why they've made it so you can't turn your Bluetooth off. And they know it's not healthy for your kids, let alone you, right? But growing people seem to be more susceptible to this. So if you are sensitive, so for example, Stephen, I'm sensitive. I don't carry a cell phone. We've wired everything in our house. You know, we've shielded the house reasonably well, and but then we have this dilemma. Well, I can't buy a new vehicle. So my newest vehicle is, or vehicles, we got two, are 2012s. And 2012 vehicles, if you do not pair your phone, it's not broadcasting, but if you pair your phone, it is. So if any of you are sensitive, or if you want to drive and not harm your children, you have to get a 2012 vehicle, or, you know, likely, I know when I was defense counsel, like the motorcycle gangs like Hells Angels and that would have people that would take all the mics and cameras out of their vehicles so they couldn't be subject to surveillance. Likely they could disable your phone. Like, you'd have to find somebody with some expertise. So, but otherwise, you're 2012 or older.
Yeah, and a lot of people sit in their cars for extended periods of time. So it really is a big issue. And the other one is cell phones. I mean, people holding their cell phones up to the ear or walking around with their cell phones in their brassieres or in their pockets. Like, whoa! I don't know if they're aware, but certainly reproductive tissue, germinal tissue, is very sensitive to electromagnetic fields. So carrying your cell phone around in your pocket next to your ovaries or your testes is not a good thing from the perspective of future reproduction, and also the risk of cancer formation and so on, which we have seen. Cell phone use and cancers seem to be connected. So, yeah, you have to be aware of that sort of stuff. But it is nice to know that that we have this innate adaptability, which can often overcome things. I think that's probably why we've overcome all these so-called pandemics, epidemics, which may have been turning on of different types of electromagnetic fields, like radio waves, or something that's been added to the general populace environment and was mistaken for an epidemic, or misread as an epidemic caused by some invisible virus.
Well, it's interesting because at the National Citizens Inquiry, when they were doing the 2023 hearings on COVID, and I think it was at the Saskatoon hearings, Dr. Meg DeHavis testified and showed, and again, correlation does not causation make, but there's a perfect correlation in the US between poor COVID outcomes and the installation of 5G cell towers.
Hmm.
And, if I recall her testimony, she had started it by showing all the evidence on how this electromagnetic frequencies can compromise the immune system. And so, one mechanism of that, if, again, correlation does not causation make, but it may be that the installation of 5G was, putting another assault on the immune system, which made people susceptible. We don't know, but it was certainly interesting. It was certainly interesting.
And they do have some case studies. They do have some case studies about 5G and people who work with 5G technicians and so on, and them getting sick, and how it's worse when they come into the field, and then better when they leave the field. And people who have who are sensitive to electromagnetic fields will they often tell the story that they're okay as long as they're away from their office, they feel better, and then they come back to the office on Monday and they start to feel sick again. It's a pretty strong correlation.
Mm-hmm. Let's move on a little bit to homeopathy. And again, like, remember I said earlier, if public health or whatever tells me black, then I know it's white. And I've just noticed over the last 10 years, if there's one tradition that the mainstream media has gone after with a vengeance, it's homeopathic medicine. And you're a medical doctor, but yet you had made a decision into your practice to also train as a homeopathic doctor. And before I ask you how that is, I'll also let people know another speaker at the health show, Dr. Michelle Perro, who is an emergency room pediatrician in Los Angeles, and her husband is a pediatrician. Their son was Stephen. It was chronic croup, I think it was, just chronic croup, and neither of them wanted to use the medical treatments. So for whatever reason, they decided to use a homeopathic treatment, and she said it was like a light switch went off, like there was immediate relief. And then she's relating other stories involving her son, and she trained as a homeopathic doctor. And I was just intrigued, in interviewing her. So, I mean, I think I asked her, like, okay, well, like, but overall, where did you get the best results? And, it's not black and white, because, it's both traditions have their strengths and weaknesses, but, it was clear that she got better outcomes and more obvious outcomes, like those real health turnarounds with homeopathy rather than allopathic traditional medicine. I'm curious, can you share with us how you came across homeopathic medicine and what your experience was with it?
Sure. Well, after graduating from conventional medical school in Ontario, I was never actually introduced to the word homeopathy. I never heard it the whole time. At least I didn't remember hearing it. And I practiced for 11 years in regular medicine until my wife introduced me to homeopathy. And my wife, Elizabeth, she trained as a naturopath in Australia. And one weekend we decided to go down to kind of have a holiday in Seattle. And there was a homeopathic conference on, like, called "What in the World is Homeopathy?" And so we went and attended that, and we met the Queen of England's homeopath. We met homeopathic historians, met family medical doctors, MDs who were homeopaths, and they presented cases that they had treated, video cases of treating a dog that was biting its. It would have these attacks of biting and chasing its owners and so on, and people, and also human cases where people had been treated successfully with 5 years follow-up minimum from diseases that in regular medicine we would say were incurable. And so when I attended that, it's a bit like a light switch went on, and I suddenly said, wow, what a great modality. I've got to learn more about this. And so then I think we were given some remedies. I remember I had a kit of 12 homeopathic remedies, and I started using them. Didn't know very much about homeopathy, but I started using a few of them during in regular medical practice, and I had some dramatic results. One with a young man with kidney failure who'd been in the hospital for months, and was discharged a week after I gave him the remedy. One dose of a homeopathic remedy. It was really unbelievable. And well, it wasn't unbelievable. I would say it was miraculous. And then also a case I met, these come to mind, a case of someone who had tendonitis of the wrist from cutting fish.
Can we just back up on this
Sure.
this kidney disease? Because he was a young my
25.
memory from interviewing him before 25, he'd been in the hospital for a full month.
I think he'd been
So
in for much longer than that, actually. I'm
Okay.
not sure. I can't remember, but he's been in there for quite a couple of months, I think, at least. And he was not doing well. He had something called nephrotic syndrome, which is a kidney disease. And he was very swollen to the point where he had so much sort of fluid on board that he was being wheeled around in a wheelchair by his girlfriend. And he couldn't walk. And so I kind of, he was being seen by specialists and so on, and they were really managing the case. But I had permission from the doctor for whom I was doing relief work to use homeopathy on his patients if it seemed appropriate. And so yes, I treated this young man in the hospital. And at first I gave him the wrong homeopathic remedy. I kind of, when I saw his history and I saw what was going on with him, even being a beginner, I could see, oh, this points to a homeopathic remedy. Seems pretty obvious. So I went and did the study, and I came up with 2 remedies. And so I carried one in each pocket, and went back and got further information from him, got an okay to go ahead and use homeopathy. Informed consent was obtained, and then I gave him one of the remedies after he forgot, and it was the wrong remedy. It didn't do anything. So a week later, I gave him the correct remedy, and my choice number 2. And within a weekend, he was feeling much better. In fact, he said it was a bit scary because he felt things shifting inside him after he took the remedy. And then within I think it was probably about 9 days or so, he was discharged from the hospital because he was improving so dramatically. And 6 months later, I had follow up. I spoke to a specialist, said, yeah, he was off all his conventional drugs, including his steroids, and was doing just fine. And so, yeah, that kind of a case for a medical doctor is what, let's say, keeps you going, because you go into medicine to help people, and you hope to actually cure people. And when you see something as miraculous as that, you just cannot go back. You have to pursue that. I think most doctors would if they saw that themselves. And with homeopathy, most people become homeopathic enthusiasts because either they or someone close to them has been cured of an illness with homeopathy that everyone else had said that's not possible. So when you see it, then you believe it, rather than reading a lot of studies and so on, of which there are many. So excuse me 1 second here.
Yeah.
There we are. So yeah, and so then I did further study in homeopathy, did a training course for professionals, International Foundation for Homeopathy in Seattle. And then I've spent time in India and Nepal studying and doing some research in homeopathy, particularly in childhood diarrhea, acute childhood diarrhea, major killer of children in the world, number 1, I think. And so I started integrating it into my practice.
When I interviewed you before, you also had talked about a woman that had tendonitis in her wrists, and basically was becoming disabled. Do you recall that case?
I do. Again, this was one of the initial cases that really got me excited. Right away, I saw the paradigm that homeopathy was using. When I attended the What in the World is Homeopathy? It's that the body has an innate ability to deal with the stresses of life, whether it's infectious or traumatic or emotional. Your boss yelling at you, that sort of thing. And I saw that it required a paradigm shift from what we normally do in conventional medicine, which is to address the symptoms only. We try to cover up the eczema with cortisone, and of course, it doesn't really work very well. It makes your skin better in many cases, but the problem will then move. The disturbed energy, let's say the struggle, will move to another organ system, usually a deeper one. So regular medicine has a way of kind of disguising the disease, and I think I realized that pretty fast. But if you want to get to the bottom level, then you need to shift your way of thinking, and to be able to have a modality like homeopathy that can tap into that ability to cure from a more profound or deeper level. So I had a case. The other case that really stuck out to me within my first couple of weeks of using homeopathy was this young woman who had tendonitis in the wrist from working at a fish farm where she was using scissors cutting fish all the time. And she was on workman's compensation board and had been on that again, I think, for about 6 months. And when I saw her again, I started thinking, oh, what can I give homeopathically? This seems like, a traumatic type of injury. So initially, for those that know homeopathy, I gave her arnica, which was incorrect. And nothing happened. So because she had to come back for a WCB, workman's compensation, now known as WorkSafe, she had to come back for forms and so on. I did see her again about a week later, and she said, no, the remedy didn't work. So I gave her a second remedy, which was rust toxicodendron, which is for overuse injuries. And we use it a lot for rusty gait arthritis, where people are very stiff on initial movement and better with continued movement. And I just remind anyone who's listening that this is not medical advice for them. They need to see their practitioner. This is not intended to give you advice. But anyway, I gave her rust toxicodendron, and she improved dramatically. In a week, she actually got off workman's comp. I couldn't believe it. 1 week, and she'd already been 6 months on disability because of her tendonitis. 1 week, she was much, much better, and was getting off workman's comp and getting ready to go back to work. So those two cases really kind of, again, it was about veils dropping. Suddenly you see that there are profound methods of treating people in medicine or in healthcare that you didn't believe existed anymore. Particularly, I've been working in medicine for 11 years before I saw that, and I'd never seen anything like that before. So I was suddenly converted to studying homeopathy and learning how to practice it. So that's what I did.
Oh, well, that says a lot. Like you said, you practiced in medicine for 11 years, and you just hadn't seen a turnaround like that. Probably either in the kidney case or in the tendonitis case.
Neither case. And so that got me started. And, I've been practicing homeopathy for more than 25 years, integrating it into conventional practice, like in a regular medical practice. And I've seen things that treatments that you could never achieve with just conventional drugs. Now, family doctors, they have a much bigger role than just prescribing conventional drugs, although, the notoriety comes from that. But, family doctors investigate and in often cases just reassure patients that they're going to get better from their cough or, things like that. And I think plus the ability to make suggestions to the subconscious of people when they come into your office is probably the most important work that doctors do. By that, I mean, you say, yes, you're going to be fine. And their subconscious takes that in, realizes there's no danger, and lets them go of the anxiety and so forth, and the people actually do get better. Mm-hmm. So it's only one part of being a family doctor.
Yeah. Now, you had said something about, you'd given an example of cortisone cream, and you said, but that can just drive the illness deeper because it's not solving the underlying problem. Mm-hmm. And I think what you're communicating is some of the time are the chemical drug treatments that we use that don't solve the underlying problem can just move the problem around in the body and actually sometimes make it worse. Did I get that right? And if so, can you just explain that so that people understand what you're saying? I think it's an point worth us circling back on.
Yeah. This is a different way of thinking about the symptoms that people exhibit, symptoms and signs. So cortisone, using cortisone for example, eczema is probably the best example because there's this eczema, allergy, asthma triad, this connection. And we see that when you treat, and this has been, if people that follow the progress of disease and know something which is called Hering's law of direction of cure, know that if you treat a superficial disease and just simply suppress it, block the expression of the disturbance which is on the skin, then it has to go somewhere. The disturbed energy has to move, and often it will move to a related organ system. So it will move to the lung. This is why we see this connection. If you block eczema artificially, you block its expression, and one day, hopefully, resolution, then it will tend to go to a different organ system like the lungs. And so we see the kids get asthma, or they get a cough that won't go away, or every time they get a cold, they keep cough, cough, cough. It's very prominent and persistent. So, and this can be observed in clinical practice. And when you use drugs that are anti this or anti that, like antihypertensive, antihistamines, anti this, anti that, it usually means that it's trying to block the expression. Now, again, this is not medical advice to stop any drugs whatsoever. I would not agree with that, and so on. But just to let people think a little differently, usually when you go, like, say, antihistamines, instead of blocking the histamine release, you have to ask, well, why are you having it? That would be normal. And you might look for the cause, right? So an antihistamine would be temporizing, but not curative. In the long term, if you keep using temporizing or palliating or let's say stabilizing medicines, eventually it does make the body go like, I can't get the problem out through that channel. I got to do something else. So it will put the disturbance into another organ system. So continual use of, let's say, an antihistamine might actually lead to having deeper problems. But those problems may occur in another organ system. So it could be in your brain, for example. It could be in your heart, your lungs. It could be in your muscles. And so you might not recognize as being connected to the fact that you have to take antihistamines every day because of your allergies. And then you start to see, well, there's other problem I have now. Now I have irritable bowel syndrome or chronic diarrhea, or, I have a cough that won't go away, or I have headaches. You might not connect those, but in fact, the whole body is interconnected. Right.
I think you said something else interesting is just, if you're having, let's say you were talking about a histamine response, well, that's for a purpose. Your body's telling you something.
Yeah, exactly. It's
right. Like there's some problem that needs to be fixed.
Right. So usually every symptom that we have is really the voice of the body. And you just don't want to say, shut up to that voice. You want to ask to understand what it's telling you. And it's not telling you, it's not to do with the voice, it's to do with what is causing the voice to speak. So yeah, you can't go around blocking symptoms and expect the person to be cured. It just doesn't work that way.
Right. So my final kind of area of inquiry is this. I kind of wanted to ask you, what do you think are, maybe 4 or 5 things that people should consider for, ensuring that they stay healthy?
Well, that's a good 5 questions. And I think most people are going to say certainly lifestyle. I think that's really key, right? So that would be, exercise and sleeping and being in loving relationships if you can, and things like that. What else? So I think that would be really, really important. And but let's put that aside. Let's assume people have a healthy lifestyle. What do they need to do? And actually, you asked me these questions, so I did actually prepare a couple of points here.
Okay.
And I think what we've been talking about today is the idea of having good food and supplements where necessary. Our food is well, let's put it this way: it's being poisoned in a way. We have glyphosate in our wheat products. We have and oats. And we have oils that are not healthy for you that are on the shelves still, like seed oils. We have, we're finding actually toxic substances like arsenic in baby food, and this means that we are being poisoned pretty much from our food, and we need to start eating good wholesome food. And organic doesn't necessarily give you protection because the organic label has been somewhat tainted, I think, and by changing the regulations, which mean that even though it says organic, it may not be. But I would say definitely eat organic food. So, and then supplements, we've already discussed that. What is wise to take, and certainly up here in Canada, you're going to want to take vitamin D because of the lack of sunshine. But and get out and do some grounding too, like walking your bare feet on the ground, or that's also a good thing. Go hug a tree. So those are kind of some basic things people can be attentive to. We also talked about changing the health paradigm, and this is what the Canada Health Alliance is trying to do. That's I'm a director of the Canada Health Alliance, and I should mention we're doing a conference in in April, which is April 24th to 26th, in near Squamish, north of Vancouver, which is it's called Self-Care is Healthcare. And the conference is designed to get people to learn the tools. It's going to be really oriented towards practical tools that people can use to improve their health and keep themselves healthy. And so that's going to be on then. I encourage you to watch it.
Can we just back up, because maybe you need to explain what Canadian Health Alliance is, because Stephen, I think especially if people are health practitioners of any stripe, that they should be involved with the Canadian Health Alliance. So do you want to share kind of what the Canadian Health Alliance is and what it offers?
Sure. I just want to clarify that it's the Canada Health Alliance.
Oh, I'm sorry.
That's okay. It's just if you try to look it up. If you look up, CanadaHealthAlliance.org, you'll come to our website and it'll tell you all about the organization. But there actually it's growing. We have about 6,000 legacy members now, and we put on all sorts of workshops and training programs. We try to be very practical in those, and we have national calls. We do have a bit of teamwork done with the Vaccine Choice Canada, and we talk about vaccine issues, which is such a key issue in the world today. And well, it has been since vaccines have been introduced, actually. But so we do lots of different things, and people can go to the website to learn about Canada Health Alliance. But we aim to make healthcare better in Canada, to improve the way healthcare is done, and so we try to educate, give educational opportunities for people to learn how to do that themselves. We ourselves, members and directors, are also looking to find better ways of doing things, and we hope to improve Canadians' health. That's our goal.
Right. Now, as I understand it, so I mean, this is Canadian or Canada Health Alliance. It's open for any practitioner. So you can be a medical doctor, you could be a traditional Chinese practitioner, you could be a naturopath, and it's meant to be a place where all these traditions can come together and share information and support each other.
Yes, but it's also open to the public. It's not just for practitioners. And in fact, most of our members are in the public, but we have people of all different medical stripes. By that I mean healthcare practitioners of all different types are members of the Canada Health Alliance, and we like to network and get people to know who's who across the country, and that's really important too. So networking is key for us to create a better and maybe even a new healthcare system, one which doesn't throw the baby out with the bathwater. In other words, there's a lot of good things in conventional medicine and healthcare, but there are a lot of things which need to be removed and replaced that are not for people's in people's favor for health. And I think the vaccination issue, from my perspective, is one of the key things here, that people really need to have a hard look at that, get the evidence, and make informed decisions, not just do what you're told or what you think the experts are telling you. You need to really do the research yourself.
Yeah, it's interesting. I'm writing an article today, and I had reason to reference, there's that new documentary, An Inconvenient Study, that
right.
Big Tree's put out with the Henry Ford Medical Center's records, which I'd invite everyone to watch that. And it mirrors, Dr. Paul Thomas. You recall he testified at the National Citizens Inquiry, and if you Google him, he has on his blog a link to that testimony, where he basically shared his research. There's, charts and graphs and the like. And it's somewhat shocking, because they're both saying, and I know they're not the only studies, but they're both showing on every single health measure that unvaccinated children are healthier than vaccinated children. Yeah. And, I think we don't understand how complicated the body is. And for us to think, like, in that documentary, An Inconvenient Study, there's that section near the end where the one lady's talking about the 3 vaccines in Africa. Is it the mumps,
diphtheria, pertussis, tetanus, DPT?
Right. So that
was Dr. Abbey's follow-up study on 10 years later, that it actually, giving the DPT, increased within 1 year the mortality rate for boys and girls in Africa up to 10 times, depending on how you looked at it. And in fact, they didn't die from diphtheria, pertussis, or tetanus. They died from other disease, which kind of suggests that the vaccine had a generalized weakening effect on these kids and
Mhm.
made them more susceptible to other diseases, which could have been diarrhea and, could have been another type of infection. Hard to know, but up to 10 times increased mortality rate. That's pretty significant from the DPT.
Well, and again, you see, no parent with that information would choose to give that vaccine if you're told your child's going to have it 10 times more likely to
Up
die.
to.
Up to, right. So, and it just seems to be an example. So we're trying to solve one problem, but the body's just so complicated that we're, overall weakening the immunity of these children. And yeah,
Well,
so
not
it's really interesting. It's really
yeah,
interesting. And
absolutely.
I think
Not
you
just,
guys are doing great work and are going to be part of a national dialogue, where we ask honest questions like, how do we get the best health outcomes? And let's look at
absolutely.
everything,
Yeah.
right?
Well, during pregnancy in Canada, it's recommended to give 6 vaccines. And I'm going to, in fact, I'm going to be speaking with Canada Health Alliance and the Vaccine Choice Canada. We're going to examine those 6 vaccines that are given and see what is the evidence for safe and effective, because it's completely lacking for those 6. And that's diphtheria, pertussis, tetanus, COVID-19 vaccine, flu shots, and RSV, which is respiratory syncytial virus vaccine. Those are all recommended, and that's assuming that you don't go traveling or doing something else too, which may add more to the list. But yeah, there's really the evidence that those are beneficial is scanty to non-existent, and all of them have big safety issues. So we tend to be throwing informed consent to the wind, I think, and also in the case of pregnancy, the precautionary principle. And if that's the case, and these vaccines are material from them, and whatever they cause in terms of antibody response going across the placenta into the fetus, then we have a double whammy there for the pregnant woman and the fetus. And it's not the best way to start life out, I wouldn't think, if you're a baby, to be full of toxins, poisons.
And am I correct that pre-COVID, I mean, the conventional wisdom was that you didn't vaccinate during pregnancy?
No, prior to COVID, flu shot was recommended during pregnancy.
Mm.
Again, if you look at the data, you will find that it doesn't really stand up to scrutiny from the point of view of being beneficial to pregnant women. And yeah, and then we've added on the COVID shot that got added on, and then also before that, the DPT shot was added in there, mostly for the pertussis element, and then more recently RSV. A respiratory syncytial virus vaccine was added to the schedule, and it was promoted. The idea in Canada now that you could skip that one if you're willing to give your baby RSV, sort of anti-RSV globulins, a type of shot that they would get on the first day of life, type of thing. So depending on what's available and what you want to do, but six vaccines during pregnancy. That doesn't make sense.
Mm-hmm. Yeah, it's well, I guess as Thomas Huxley wrote, and it's a brave new world, isn't it?
Aldous Huxley.
So, oh yes, Aldous Huxley. That's right.
Thomas
yes, brave new world
was his twin. No, I don't know. I'm just making that up. No, Aldous Huxley. Yeah, Brave New World.
Yeah, we can all go into our birthing decanters, and so. But it's funny that both Orwell's 1984 and Huxley's Brave New World, I mean, really seem to predict where we're going.
Yeah.
Well, I just thank you for being on. I always enjoy interviewing you, and really respect the work that you do and the work that you have done. And it's just been a pleasure and an honor, Stephen, to have us on. Any last words of wisdom?
Well, Sean, you haven't given me 5 yet.
Oh, okay. Well, let's finish those 5.
Yeah.
I didn't want to rush those.
It's okay. I just thought I would leave the last, what I think are the probably the most important ones, to the end. And I think one is worry. People have to learn how to stop worrying, because this is just a drain, and it makes life so unpleasant. And in these last years, we've kind of feel like we've been assaulted from every different direction. during the COVID era, but even sub that time. And if people are now attuned to the news, they hear about wars and this and that, and they're worried. People are having trouble putting food on the table. The price of things is going up, and we seem to have lost confidence in our medical profession, but also we've lost confidence or realized that we should never have had it in our government and the things they're doing. The people are being taxed heavily in Canada, so on. So it's pretty hard not to worry. So I think that needs to be countered in some way, worrying. And maybe I should toss this back to you, Sean, to see what do you think is the way that people can overcome this habit of worrying in today's world?
Oh, wow. Okay. So first of all, that big H for hypocrite on my forehead will be,
No, we all do it.
burning,
We all worry.
burning soundly. How I'm dealing with it nowadays is, understanding, well, two things. So first of all, there's nothing new here under the sun, Stephen. If, you can read any history, and I mean, it's just death and chaos and war and people being really awfully cruel to other people. And, and some of us, we've felt overwhelmed during COVID. Like I have to tell you, before those truckers started rolling, I was feeling pretty dismal. In my opinion, we were sliding towards a police. Well, weren't towards a police state. We were in a police state. I couldn't believe, that basically we were. I had clients under house arrest that had more freedom than, the general population during COVID. We'd never seen restrictions like that, even in wartime, and so. Yeah, and then the truckers start to roll, and I realized, we can make a difference. And now I've come to understand, like I approach things with the Christian belief system. In Psalms, when David is writing, and it's the Holy Spirit writing, he explains that basically there's a book written about you before you're even created. And it sets out your destiny, what you're supposed to accomplish. And we're created for this time. So we're not meant to be overwhelmed by what's going on. We were deliberately designed to be here at this time because we have specific things that each of us are supposed to do and we're supposed to learn and that we're supposed to participate in. So why should I be overwhelmed, Stephen, when I'm actually specifically designed to be here to do what I'm supposed to be doing at this time? So that's kind of like how I'm dealing with it. And yeah, so I don't know if I answered your question or not.
No, I like that. I think that was good. So having a proper attitude towards the events that are occurring around you, the seeing that you're here for a particular reason, and without the friction, you can't actually have the change of metals in the crucible to create a new alloy. And so, and we're part of that. We're the pushback team, I think. And but also that new alloy that we're supposed to be creating at this time, I believe, is it has some elements to it. And if we kind of see what we could be doing, how we could have faced this differently, that might give us some clues. So I think, yes, we're not here by mistake. I don't think that's the case. And so we should be happy that we're actually got this opportunity to do what we were meant to do, what we were created for. I think that's a great way. One of the things I think is a good technique is actually developing the habit of gratitude. And I don't think you have to develop it like a habit, which means every day go out and actually look at something around you that is fantastic, like just a flower and the sort of, the degree of complexity and how beautiful it is, things like that. So I would say developing gratitude, and gratitude for having the opportunity to be here at this time and to be able to, fight for human happiness, I would say would be part of that. To develop this kind of insight into what to do next when things are tough, people need to investigate. And just as during the COVID era, people learned that they could not trust someone like an expert, they had to do their own investigation. Similarly, we need to investigate the reason that we're here and what's going on and how that all fits together, and in a in a holistic pattern, or that we can understand. So just like medicine, we need to see the part in relationship to the whole. And so I think that being inquisitive, investigating, and that would lead to actually maybe doing a meditation practice of some sort, just quietening down that thinking apparatus, which is just like a monkey house up there. And often it goes off on these sort of tangents of imagination. And imagination, what could happen, having hope, having fear, two sides of the same coin, is leads to worry, right? Leads to the emotional response. So we need to control our minds, and they only do that through practice. So I would say that adding a meditation practice daily, even if it's 5 to 10 minutes, is a really important thing. So I think between you and I, we've kind of got some good ideas of how to counter the stressful world we live in these days. And in giving thanks is really key to that.
Yeah, it's interesting because we do get caught up in our thoughts, right? Like, let's say somebody offends us or something happens, we can just be thinking about that and attaching and having an emotional reaction. And that's all in our heads. We could be thinking of something else. Like, we don't have to be having that. It's not real. It's all in our minds. And I'm really having to learn that, that just, I don't have to think about that. And I remember there was a study where they asked people that, had reached at least 100 years old, what would they say to people younger? And they would say, worry less. Like, we worried about stuff we didn't have to worry about. And like, that was the number one piece of advice from people who had made it to 100 years old, was like, we all worry too much. And I thought, that's interesting. So I really, what you're saying is really gelling with us.
Yeah, it is
to be healthy.
It is a waste of
we
time.
have to be healthy.
Yes, we need health. We need healthy minds, and yeah, worry is very wasteful. And if you look back at your history of how much worrying you've done and how few of those things you worried about never came about, you realize how wasteful when you could be doing something better. But it's very hard because worrying is a habit. Worrying is a habit, and so to break habits requires effort. And if you see how important it is to break that habit and to create a more lighter way of going through the world, I think that you're going to have to dedicate a bit of your time to doing some kind of practice of not going with all your thoughts, just letting them, like a fountain, a fountain of thoughts. That's kind of what it's like. It's constantly streaming up, sprouts of water, and you got to have to learn how to just to turn it off, or just let it go and not give it energy, because the more energy you give it, the more you feed it, and the more it continues, right? Like most habits. So I think that's really key, is we have to kind of control our minds, our thinking apparatus, and our emotions, and we do that through practice, and not being so attached to them. Don't take them as being so real. They're here one moment and gone the next, right?
Mm-hmm. Yeah, no, that's good advice. And it's interesting that I imagine you brought it up because you're working at it, and I know I'm working at it, and likely everyone watching is working at it. So
you've got to. I think it's essential. Life, and then I think some of the questions of should I do this or should I do that will become more the right choice will become more obvious to us. It's got to do with awakening certain qualities that we have as humans, which will guide us through this life. What is the right thing to do, and the wrong thing to do? It's like awakening conscience, and and we'll learn a few other things on the way.
Well, I mean, it's none of us can complain that life isn't interesting right now.
That's true.
So maybe we can complain that it's too interesting. So, yeah. Well, Stephen, it's just a pleasure and an honor to have you. Thank you so much for attending and sharing with us today.
Yeah, thank you, Sean.